The other products and platforms that we've been testing recently is Actual Health Services, and on board now and here to talk about what they're seeing in the connectivity world between practices, whether it's primary and specialty or specialist specialty or all of the above to patient, is the CEO and founder and board chairman, Dr. Jamie Wisser, and his partner here, Robert Holton, who's president COO. And we're going to talk a little bit about this for the next few minutes, everyone. And it's important to hear, again, like we talked about earlier, the adoption of digital is asymmetrical in what we're seeing in the ecosystem today. And this is one of the platforms that the lab has studied that's seeing a nice uptake and significant adoption. So let's start off. Gentlemen, welcome to the program today.
Hey, Stan, how's it going?
Hey, Stan, how are you?
Going well. It's going well. And looking forward to talking here because you guys have a lot of incredible insights to add to the equation. So let's start with this. How are you envisioning this role of innovation when it comes to transforming public health services at the national level? Like we just heard Ben talking about Medicare, and what are you seeing in terms of your platform and public health services?
I guess I'll start. One of the things that has been so important in the innovation of our technology has been the idea of how can we make the technology be available to the average individual, primary care doctors, specialty physicians, and hospital systems to make the sort of the exchange of patient care, what we call the referral network, seamless, right? So you know, and I'm in our last fireside chat, if you break it down into what we described as being the critical element of the healthcare system, it was ultimately the patient-doctor, relationship. So how does that patient-doctor relationship get refined? Right now, we use faxes, phone machines. We use, people we're familiar with to call and contact to refer patients for specialty treatment. But there has to be a system that can be more standardized, I think, to the last speaker's point. We need something that is uniform. We need something that's predictable. We need something that speeds, access to definitive care, is a good matching system for patients and doctors. The doctors can provide the best care for that type of patient, where the doctor and the patient and the primary care doctor are in a triangle, and they're all working together in that referral process. So the actual delivery of the care is definitive when the presentation of the patient, the in-person part of it, has been sort of screened and programmatically made easier and faster and more efficient by technology, which is kind of where we've really sort of said is our beachhead, it's our focus. And in all honesty, there really isn't any other system out there that we've been able to come across that is focusing on this particular element. And so that's where we think it's important. And from, the who's going to pay for it and how's it going to have a long-term revenue source. Ultimately, the hospital systems and the doctors' practices, they're all looking for, younger patients who are easier to take care of. They have the best payer mix. They have the decision-making for their children. They have the decision-making for their dependent adults. They are the group that's the largest population in the country right now. And everyone is competing for them through advertising, through, outreach, programmatic approaches, whether it's online or whether it's in-person symposia. But the punchline is that everybody wants these patients. And those who subscribe to our technology are going to have a new methodology by which to attract these patients and be able to increase that population, which ultimately is the future Medicare population. And they're literally planning not only for the present, but they're also planning for the future.
That's great. And again, I think it's important that the audience realizes that Dr. Wisser is not just the founder and the CEO and the board chairman of this company, but he's also a practicing physician. So you can see he's actually in his smocks right now and just probably in between surgeries or whatever.
No, literally in between operations.
And Rob, again, you're doing great work here. You're a veteran of multiple startups and exits. You know what you're doing. And talk a little bit about some of the value creation and some of the work that you've seen already with AHS that exemplifies how the company is pioneering this kind of new solution in public health.
Yeah, absolutely, Stan. And I just want to take a second. Kudos to Ben before us. A powerful speaker. I thoroughly enjoyed it. And unfortunately, we had to follow him. So great job, Ben. Great information. Just real quick to kind of follow on what Jamie was saying on the bigger picture, I think, one of the keys here, from driving, improved healthcare outcomes, one of the kind of the easier ways to do it, or important ways to do it, really is improving care collaboration, right? Everybody knows, the more we can collaborate from provider to provider, whether it's physician to physician, physician to specialist, right? We have definitive improved healthcare outcomes from that. And really, this platform specifically allows us to address those types of issues. Whether you're talking about, internal collaboration from within the healthcare system, or if you're talking about larger healthcare systems that are dealing with fragmentation issues, right? A system like AHS can play a critical role in that kind of care collaboration. And then also, as Jamie was pointing out, from a new patient acquisition standpoint, or really it's the way we look at it, more democratization of the access outside of your healthcare system, right? Being able to transition effective referral, search, find, and refer, but also be able to smooth that transition, right? And track that transition throughout the referral process. Are they, getting the appointment scheduled? Is the appointment happening? Are we getting speed to definitive care? And are we filling in all of the gaps along the way, from a medical record standpoint, testing and imaging, from a HIPAA compliance standpoint? I mean, really, that becomes the critical nature of how do we solve that care collaboration when providers aren't in the same office, aren't in the same city.
Yeah,
The other
that's an enormous challenge. And it's very clear that the public health system is really having an issue in putting that together. We've got about 5 minutes left, and I think, we really want to touch on a number of other areas, but one of the things we want to talk about is, when you look, Jamie, when you're looking at the ecosystem and you're looking at this kind of opportunity, who are some of the groups, whether it's clinics or whether it's health systems or hospitals, who are you trying to collaborate with across the ecosystem to better deploy what you guys have invented and what you're scaling, and how you can help patients that they have receive better care because of the platform's features and functions?
We're focusing on specialists. Specialists make up a significant portion of the healthcare, provisionary sector. There are quite a number of primary care physicians, but the specialists tend to be sort of the definitive interventionalists, those who are referred to for, access to definitive decision-making, definitive execution. And so by focusing on the specialists, we're kind of doing this differently than anybody else who's working in the patient acquisition sector. Most focus on primary care, most focus on patients being able to schedule, appointments on an open platform. The specialists have an opportunity. We're sort of balancing the playing field. They have an opportunity to select their patients. They have an opportunity to decide who they're good for to help when the referrals come. And I think the other important and critical element to the platform, which is so important, is that whether a patient initiates an inquiry, or a primary care doctor, or even a community specialist needing academic assistance and coaching initiates the inquiry for a referral, the system is built to close the loop. So the information is AI assisted for generating the documentation. The availability of the documentation is reviewed by the doctor, is signed off, and then it's shared with the referring primary care doctor. So that closed loop, keeping everybody in the game, keeping everybody knowledgeable, can bring the quickness and the efficiency of the care to a new level that is it's unprecedented. And the fact that the platform does that itself is paramount, and makes it easy for those who are using it, both patients or doctors on behalf of the patients, because many patients are not necessarily technologically savvy.
That's absolutely spot on. And we've seen there's such a socio-demographic difference and such a socio-technical difference across the demographics that it's very difficult to have one technology work for much more than maybe even a plurality of a patient population. So you're absolutely right that really having a platform that's going to be able to work with 95% of the patient population is a major challenge. And let's build off of that, Rob. Again, we've got about a minute left here, but from your perspective, when you look at all the different types of trends and technologies that are shaping this kind of healthcare delivery in the future, what is AHS doing to help, like Jamie was saying, the clinics and the patients better prepare for this and be prepared for all these, even what Ben was saying, just the tremendous differences that we're going to see in healthcare delivery over the next 10 years. What is AHS doing in that realm to help clinics and physicians be more competitive and help patients get the best care possible?
Yeah, I think, look, primarily it comes down to seamless integration, right? And, as we have diversity of providers, healthcare systems, insurance, EMRs, technologies, as Jamie was pointing out earlier, I mean, the key is how do you transition all of those? And the core architecture of the AHS platform allows us to be able to seamlessly integrate, with not only just the major players like a Cerner or an Epic, but even kind of the smaller, like physician-driven or independent physician groups, EMRs, because at the end of the day, the access to the data is key. Being able to do it in a clean and efficient manner allows us then to be able to utilize that data and push it back out to the patients, right? So that we can have personalized, help with the personalized care plan, but also allow them to be able to have a say in their own care moving forward. But again, it starts with being able to integrate all of these disparate sources. And look, that's kind of always been the holy grail in health IT. The architecture we have is unique. It allows us these seamless integrations without really having to drill through firewalls, so on and so forth. So we're pretty excited about that, and I think it's going to have a longitudinal impact on how we look at delivering care from a data standpoint moving forward.
And if I could just add one quick thing in the last 30 seconds, it's data sharing of verified information. This is so critical, and it's been the paradox in this whole health information exchange environment, which has been, how do you make sure that the data that's been pulled is matching the actual patient? Patient data mismatching can be life-threatening. And the way we've designed our system, there's patient and physician verification of the data before it even gets moved into the platform itself. So in that regard, we add the human component from those most knowledgeable with the patient's clinical care, i.e. the patient, him or herself, or the doctor. So I think that sets us light years apart between that and the universal HITLAB, I'm looking at HITLAB, the universal HIPAA exchange that makes it all legitimately matching what the 21st Century's Cure Act 2.0 insists upon, I think are tremendously advantageous for those who are able to start using it.
It's fantastic. Well, thank you both for joining today, and looking forward to having you back on soon, and good luck in the continued adoption and deployment of the platform.
Thanks,
Dan.
All right.